Thank you for your leadership to ensure student cyber safety. I'm very honored by your invitation to render testimony to support raising awareness about cyberbullying and its toxicity, and to provide recommendations for addressing this important issue through the Elementary and Secondary Education Reauthorization Act. I'm a child and adolescent psychiatrist and pediatrician, testifying on my behalf and that of Children's National Medical Center, which provides leadership in clinical research and advocacy efforts to prevent health problems linked to bullying. There is an evolving understanding that cyberbullying is a very serious public health problem, prevalent around the world, and linked to serious health problems, including suicide. Cyberbullying is manifested by victimization, mistreatment, or abuse through electronic forms of contact, primarily the internet and/or mobile phones. It can include harassment, threats, insults, teasing, calling names, and spreading rumors. Moreover, it may consist of sharing embarrassing pictures or videos, incitement to hurt somebody, password theft, privacy violation like cutting and pasting, or spreading viruses. It has been estimated that at least 14% of US adolescents in grades 6 to 10 have been electronically bullied in school. This doesn't count the kids that are being bullied, cyberbullied outside this setting, at least once in the previous 2 months. Cyberbullying can occur in and out of school premises, with the identity of the perpetrator being known by at least 70% of the students being victimized. 50% of the known perpetrators are schoolmates. 90% of victims do not report cyberbullying to their parents because they feel that they need to deal with this problem by themselves, or they're worried that their internet privileges may be curtailed. Cyberbullying can occur simultaneously with other forms of mistreatment happening in schools and other community settings. Victims, perpetrators, or bystanders are at significant risk of suffering from an array of health, safety, and educational problems, including depression, frequent absenteeism, eating disorders, and above all, suicidal attempts. Traditionally, US schools have been at the forefront of helping, for the last more than 100 years, been at the forefront of helping to safeguard the health and safety of their students by contributing to the prevention and detection of public health hazards, such as, in the first part of the 20th century, communicable diseases, and later on, psychosocial risk factors. In this context, schools are now being challenged to prevent the safety and health risks linked to bullying and cyberbullying with the support of health professionals and the whole community. Since '94, state legislatures have been addressing the issue of school bullying. As of June 2010, 42 states have enacted legislation designed to reduce or prevent bullying and/or harassment among public school students. Half of these statutes include language pertaining to harassment through electronic communication, usually on school premises. These laws have a wide scope of legal coverage and jurisdiction, varying in the definition of bullying, the recognition of its link to health safety risks, and the support and strategies to create an infrastructure for bullying prevention. In order to preserve the physical and emotional well-being of children and adolescents living and studying in the United States of America, it is critical that the United States Congress should enact bullying and cyberbullying prevention legislation. Towards this end, we respectfully recommend that ESAEA reauthorization address promotion of public awareness about the nature, toxicity, and prevention of bullying and cyberbullying, development of safe schools through programs that enhance mutual respect, sensitivity, and support of others, tolerance to diversity, and disapproval of bullying and cyberbullying, implementation of research-based school-wide bullying prevention programs for all students attending elementary and secondary education, fostering the necessity and obligation to report incidents of bullying as a conscientious community public health attitude with safeguards against any threat of retaliation or liability for those who report, and support or guidance in reporting bullying, cyberbullying incidents through a hotline, monitoring and detecting ongoing bullying incidents, providing school intervention through school counselors or nurses to protect and support students who are being bullied. Perpetrators should be counseled or sensitized about the harm inflicted while helped to develop respect, empathy, tolerance, and sensitivity to others. Consideration of referral for medical evaluation and treatment for victims and perpetrators who experience physical and psychological symptoms linked to bullying. I want to thank the Academy of Child and Adolescent Psychiatry for their extraordinary support in helping me to prepare this testimony.